Imagine this. It's 7:12 a.m. The bathroom light is brutally honest and you're leaning toward the mirror like it owes you an explanation. One tiny pimple shows up on your chin and suddenly your brain turns into a late-night infomercial. What if I just zap it with something? Vinegar, lemon, toothpaste, alcohol, and that's exactly how people accidentally turn a small skin issue into a full-blown face crisis. Today, we're going to talk about things you should never put on your face, or at least never put there without knowing exactly what you're doing. And I'm saying this as someone who's been around skin problems for decades. I've seen every DIY trend come through the door like a parade. Harsh acids, harsh alkalines, natural oils that are basically chemical weapons in a tiny bottle, and products that sterilize the face like you're prepping for surgery. The problem is, your face isn't a kitchen counter, it's an ecosystem. Your skin is the largest organ in your body. It's not just a covering, it's a living boundary between you and everything outside. And the face, especially, has something called the acid mantle. Think of it like a thin, invisible shield, a protective layer with a slightly acidic pH. That part matters because your skin isn't neutral. It's not alkaline, it's mildly acidic, typically around 4.5 to 5.5. And pH isn't a cute little number, it's a logarithmic scale. That means tiny changes are massive changes. Going from pH 7 to 6 isn't a little more acidic, it's 10 times more acidic. From 6 to 5 is another 10 times. Your face is designed to live in that acidic range because the microbes living on your skin help keep it that way. In just 1 square centimeter of skin, you can have over 1 million microbes. Not germs, as in the scary kind, many of them are your allies. They help defend you, train your immune response, and keep opportunistic troublemakers from moving in. So when people casually put harsh stuff on their face, they don't just irritate the surface, they bulldoze the ecosystem. And then what happens? Redness, rashes, breakouts, dry patches, burning, sensitivity, sometimes pigment changes, sometimes a cycle that takes weeks to calm down. So let's go through 11 common things people put on their face that can cause real problems, and I'll explain why they're risky, not just that they're bad. Number 1, undiluted apple cider vinegar. Yes, it's acidic, and yes, people love the idea of balancing skin, but straight apple cider vinegar is not skin-friendly acid. It's way too aggressive. We're talking pH levels around 2 to 3. That's not toner, that's ouch. It can burn, inflame, and disrupt the acid mantle so fast your face can turn red like you got caught in a windstorm. Here's an easy way to understand how strong it is. People literally use vinegar solutions to kill weeds, and it doesn't just kill weeds, it can kill the grass around it too. So imagine what that kind of acidity does to delicate facial skin. If someone insists on using it for some reason, it must be heavily diluted, like a teaspoon in a full cup of water, and even then, a patch test is non-negotiable. But straight, never. Number 2, lemon or lime juice. This one feels clean and fresh, right? People think it's fruit, it's natural, it must be gentle. Wrong. Citrus can trigger a nasty reaction when combined with sunlight called phytophotodermatitis. Basically, plant chemicals plus UV light equals inflammation and discoloration. You put citrus on your face, you go outside, and your skin can respond like you spilled a chemical on it. Sometimes it looks like a burn, sometimes it leaves dark patches that linger, and it can happen even if you don't feel immediate pain. Citrus is also quite acidic on its own, so you get irritation plus sun sensitivity. That's a brutal combo. Number 3, essential oils, especially the strong ones, directly on the face. Essential oils are not plant water, they're concentrated chemical cocktails distilled from plants. That doesn't automatically mean they're evil, but it does mean they're potent. Tea tree, cedarwood, peppermint, oregano, some of these can irritate the face fast, even if they're fine on tougher skin elsewhere on the body. The face is different, thinner barrier, more nerve endings, more reactivity. The safest rule is this: if you're going to use any essential oil on the face, it should be properly diluted in a carrier oil and tested on a tiny area first. People skip that step and then they act shocked when their cheeks feel like they're on fire. Number 4, bergamot oil or bergamot heavy fragrances on the face before sun exposure. This is a classic phototoxic one. Bergamot is used in some perfumes and essential oil blends, and it can massively increase sun sensitivity for some people. Put it on, go into sunlight, and you can end up with redness, inflammation, or pigment issues. It's not allergy, it's chemistry plus UV. Number 5, baking soda. This one is sneaky because it's marketed as a gentle natural exfoliant, but chemically it's the opposite of what your facial skin wants. Baking soda has a pH around 9. Remember the pH scale? That's not mildly alkaline, that's dramatically more alkaline than your skin's natural range. When you rub baking soda on your face, you shift the environment away from where your protective microbes thrive. It's like pouring bleach into a fish tank and saying you're cleaning it. You disrupt the acid mantle, you stress the barrier, and then you wonder why your face gets dry, tight, irritated, and breakout prone afterward. Number 6, toothpaste as a spot treatment. This trend refuses to die. Toothpaste is made for enamel, not facial skin. Many formulas contain harsh ingredients, strong detergents, flavoring agents, whitening compounds, sometimes peroxide-like components, and other stuff designed to scrub stains off teeth. That can cause irritation, chemical burns, and flaky red patches around the mouth or chin, exactly where people usually apply it. If you want a true spot strategy, there are far better options than smearing dental chemicals on your face. Number 7, rubbing alcohol. This is the nuke it from orbit approach. Alcohol is antimicrobial, it kills microbes, and people think that means it kills acne. But acne isn't just dirty skin. When you repeatedly wipe alcohol on your face, you strip oils, damage the barrier, and wipe out the good microbes that help keep the ecosystem stable. Then your skin overcompensates, gets more reactive, and opportunistic bacteria and irritation can flourish. The irony is, the more you sterilize your face, the more fragile it can become. And watch out for skincare products loaded with alcohol too, especially if you're already dry or sensitive. Alcohol can dry you out and destabilize the barrier, which invites redness and flare-ups. Number 8. Hydrogen peroxide. People use it to clean wounds, bleach stains, whiten teeth, so they assume it's fine for skin. But peroxide is strongly oxidizing. It doesn't target only bad things. It can irritate tissue, disrupt microbes, and cause uneven lightening or damage depending on how it's used. Facial skin is not the place for that kind of harsh oxidation as a casual DIY treatment. Number 9. Hair dye on eyebrows or eyelashes. This is a serious one because now we're talking about the eyes. Hair dye is formulated for scalp hair, not for the thin skin around the eyes, and certainly not for lashes. If dye gets into the eye, it can cause severe irritation and, in worst cases, real damage. People have had injuries from this. If you want brow or lash coloring, it needs to be done with products specifically made for that area, handled carefully, ideally by trained professionals. Number 10. Topical steroids used repeatedly on the face. This is extremely common. Someone gets redness or flaky irritation and they're given a steroid cream. Steroids can calm inflammation quickly, almost like magic, and that's exactly why they're risky, because people keep using them. On facial skin, repeated steroid use can thin the skin, reduce collagen production, and lead to visible blood vessels, atrophy, pigment changes, and flare-ups that come back stronger when you stop. It can also disrupt the skin's immune defense, making it easier for the wrong microbes to overgrow. That can look like persistent redness, acne-like bumps, or rosacea-like symptoms. Steroids have a place in medicine, but long-term casual use on the face can create a problem that's harder than the original issue. Number 11. Harsh exfoliating scrubs every single day. I get why people do it, especially if they have acne or texture. You feel roughness, you want to scrub it off, but if you sand your face daily, you're not just removing dead skin, you're wearing down the protective barrier and disturbing the microbiome. It's like power washing a painted wall and then acting surprised when the paint starts peeling. Many people assume healthy skin is extra clean skin, so they scrub harder and more often. And then the face gets redder, more sensitive, and sometimes breakouts worsen because inflammation is now part of the cycle. Exfoliation can be useful, but frequency matters. Your face isn't a frying pan. Now let's add 2 silent offenders people forget: shower water and makeup. If your water is heavily chlorinated, that can be drying and irritating for some skin types, especially if you're already struggling with barrier issues. A shower filter can sometimes help reduce harshness, and makeup, especially heavy foundations and fragrance products, can irritate sensitive skin and disrupt the surface environment if you're layering it daily without giving the skin recovery time. Fragrance is a common trigger for irritation, and nice smell doesn't mean skin-friendly. So here's the big takeaway: your face doesn't need to be sterilized, it needs to be supported. The goal isn't to scorch the surface until nothing can live there. The goal is a stable barrier, a healthy acid mantle, and a balanced microbiome. Because when that ecosystem is intact, the skin tends to be calmer, less reactive, and more resilient. And if you've been doing harsh DIY treatments and your skin feels angry, don't panic. The first step is often the simplest. Stop the assault, simplify the routine, and let your barrier recover. Gentle cleansing, minimal irritation, and patience usually beat one more hack. Now that you know what to avoid, the next question is obvious: what should you actually put on your face to support healthy skin without destroying the ecosystem? That's exactly what I'm covering in the next video. So if you want the safest, most skin-friendly approach, go watch that right now.